9:30, so we've got quite a packed programme today, so I think we'll make a start, and obviously more people can join us as we go. So thank you all for joining us today. It's great to see some of our regular PAPIG members again, and also to see some new faces too. And all of us here at AWTTC hope you find this morning's event interesting, informative and engaging. So my name is Claire Elliott. I'm a senior scientist at AWTTC and also the lead for patient and public engagement. So involving patients, carers, patient organisations and the public of Wales is a priority for us. And we hope that this meeting will highlight areas of our work where your views and input are essential. Therefore, we very much encourage you to have an active role this morning. Please feel free to ask us any questions or comment on anything you hear, either by using the Zoom chat function or by speaking in the open sessions of the meeting. Due to time, we may not be able to answer all your questions this morning, but we will definitely get back to you afterwards. I just also want to make all participants aware that this meeting is being recorded and it will be made available via the AWMSG website at a later date. Anyway, as I said, we do have a packed programme and time is short. So I'm going to introduce our first speaker, Ruth Lang. Ruth is our liaison manager and she will be giving you an introduction which will help set the context for the rest of the morning. So over to you, Ruth.
Thanks very much, Claire. Thank you, Anne, for sharing the screen. So good morning, everybody. Lovely to see so many faces. My name is Ruth, and I've been involved with the All Wales Medicine Strategy Group for more than 20 years. When the vision of my boss at that time, Professor Phil Routledge, and this is Phil, came to fruition. So at that time, Phil chaired the local Medicines and Therapeutics Committee. And that committee made local decisions on medicine. He could see the benefits, though, in having one national committee which would make decisions for the whole of Wales, particularly for the difficult and complex decisions required on high-cost medicines. So a task and finish group was set up, and that also came to the same conclusion and recommended the establishment of a national advisory committee on medicines and prescribing. So that's how I came to be involved at the start. So you could say I was roped in, but the fact that I've hung around for 20 years speaks for itself, I think. So some of you may be unfamiliar with the different roles of the All Wales Medicine Strategy Group and the All Wales Therapeutics and Toxicology Centre. So I'll try to clarify this before I go any further. So the All Wales Medicine Strategy Group, which we call AWMSG, is a Welsh Government advisory committee. It's got around 16 members who all have different roles and they represent each of the health boards. The All Wales Therapeutics and Toxicology Centre, AWTTC, is an organisation. It's hosted by Cardiff and Vale Health Board, and we have 56 multi-professional staff, including doctors, pharmacists, pharmacy technicians, scientists, medical writers, administrators, a health economist, IT, data analyst, and apologies any of the team if I've overlooked anyone. So AWTTC provides professional support and secretariat services to AWMSG and its two subgroups. And the best way I could think of describing AWTTC is the engine room of AWMSG. It's the principal source of energy with lots of activity. It's unique in that it's got two distinct sections, therapeutics and toxicology. It brings together frontline hospital doctors with a team of scientists and other professionals who all work together to promote safe and prudent prescribing to ensure that the people of Wales get the best outcomes from their medicines. Currently, AWMSG and AWTTC have their own websites, but work is ongoing to merge these. So in future, if you're looking for information on medicines and prescribing, there will only be one website, and we hope this will be far easier for everyone. Perhaps we'll be able to show you this at the next PAPIG meeting. As we're based in a busy university hospital in Landock in the Vale of Glamorgan, we are reminded on a daily basis that our work impacts on patients and their families. We're very keen to involve members of the public and patients, and we're hoping that after this meeting that you'll want to get involved in some of this work. To improve the health of people living in Wales and ensure that healthcare and resources are accessible and equal, health professionals and members of the public all need to work together. And this is the reason why we have a patient and public interest group. We want to hear what matters to you. What challenges do you have in taking your medicines? And we want to know how best to communicate with you and relay important information on medicines. In turn, we're going to tell you what we're doing, what we've done over the past few months, and what we plan to do. So whether you're here today to learn more about decisions on new medicines or interested in the development of best practice, we're very grateful for your interest, and we hope that these PAPIG meetings will help us reach out to more people and to raise awareness of our work. So Leah will focus on communication and engagement in her presentation a little later. Before this meeting, we circulated an article which summarised AWTTC's activity during the pandemic. I hope you found this useful. The last 15 months have been hugely challenging for everyone. AWTTC has been agile and adapted its work to support our NHS colleagues and Welsh Government. Some members of the team are now going to tell you more about the work they've been involved in over the last few months. But I need to hand back to Claire to make this happen. So thanks for listening, everyone, and please don't hesitate to ask questions via the chat function.
Thank you, Ruth. Our regular PAPIG members will know that this is our first meeting since the start of the pandemic, and as Ruth mentioned, the usual business of AWTTC was adapted to support NHS Wales tackle COVID-19. And so to give a flavour of what we've been involved in over the past 16 months or so, the following short video features 3 AWTTC colleagues giving a very brief overview of 4 particular projects that AWTTC led on as part of the COVID response.
At the start of the pandemic, it very soon became apparent that there needed to be a go-to place for healthcare professionals to be able to access reliable information about COVID-19 related medicine queries to support the care of this new patient group. Some members may remember at the start of the pandemic, the confusion around whether it was safe to use ibuprofen in case it may worsen the effects of COVID. There were also concerns raised around a common group of medicine known as the ACE inhibitors, which were thought to be associated with increased risk of developing COVID infection. Both of these issues, of course, turned out not to be substantiated, but at the time AWTTC were able to provide reliable, evidence-based information to healthcare professionals to support their decision-making and the care of their patients. This information was provided by a newly created COVID-19 Information Hub, which is cited on the awttc.org website, directly accessed via the homepage. Primarily, the Hub provides summaries of information with links to associated documents, etc., for healthcare professionals to be able to access in one convenient place. The information within the Hub is stored in a number of subsections to aid retrieval. Due to the unique place that AWTTC holds within healthcare in Wales, we're able to call upon other specialist organisations within Wales, for example, Welsh Medicines Information Centre, wider organisations across the UK, for example, NICE, and even our previous clinical director and founder of AWTTC, Professor Phil Routledge, has assisted with his vast experience and connections to support the information provided on the Hub. As we've gone through the pandemic, the information sources within the Hub have evolved, moving from medicines that may potentially worsen COVID-19 to medicines which can treat COVID-19, and now more recently in support of the highly successful vaccination programme in Wales. The information around vaccines, as well as including UK-wide information, also contains Wales-specific information, for example, from the Welsh Government and Public Health Wales. We continue to add information to the hub as soon as it becomes available. And within just the last week, we've added further information around vaccinations and the recommendation not to use ivermectin to treat COVID-19. The delivery of the COVID-19 Therapeutic Advice Hub has been a successful collaborative effort from both within AWTTC and across our stakeholder network. The ability of AWTTC to have delivered this from the start of the pandemic, to have it evolve and still be relevant, has been a significant achievement. And only last week, our Chief Pharmaceutical Officer in Wales described the hub as a great resource. The hub continues to be available on the awttc.org website and is accessible for all. So please do take some time to have a look. And of course, feel free to email us with any suggestions that you may have for additional content that you may like to see. Thank you.
AWTTC also had a pivotal role in supporting the development of end-of-life service to deliver vital medicines to patients across Wales within 90 minutes of a request from a GP. The service was implemented in response to the first COVID-19 surge to improve access to the supply of palliative medicines. The overall approach was intended to reduce uncertainty and delays in securing medicines and increasing the agility of potentially limited supplies, so making stock go further. Healthcare professionals identified palliative care medication as being a major concern during COVID-19 and had the potential to compromise the delivery of the best standard of end-of-life care. The period of unprecedented pressure created by coronavirus led to an increased demand and concerns around the availability of end-of-life medicines requiring a rapid change of approach. AWTTC worked collaboratively with a number of organisations, including NHS Wales and the Health Courier Service for Wales, to develop the end-of-life medicines just-in-time service, GEMP for short, by deploying a member of the Welsh Analytical Prescribing Support Unit to project manage the development and implementation of the service. The end-of-life service was deployed in just 6 days and provided a single point of access to GEMP packs during the pandemic. The service aimed to deliver the GEMP to patients within a 2-hour window, and through effective collaboration with the National Courier Service and the support of the 5 pharmacy end-of-life hub departments based in already busy hospitals across Wales, the GEMP packs could be delivered to any location across Wales within a 90-minute window and support a 24/7 service. The delivery of these vital medicines ensured rapid symptom control and allowing dignified care for people as they move towards their end of life. News of the service caught the attention of the media, and members of the team were interviewed by both S4C and the BBC, and their interviews were broadcast on the evening news slots as examples of successful collaborative work across Wales during the pandemic.
The global COVID-19 pandemic has placed significant pressures on the availability of certain medicines in Wales. To support the potential need of an equitable mutual aid process for the provision of certain low availability medicines, AWTTC were asked to set up a collaborative project to develop tools for reporting the stockholder medicines from across secondary care in Wales. Initial action was for us, in conjunction with the NHS Wales Informatics Service and procurement leads from across the health boards, to facilitate pertinent data extraction from the different pharmacy systems used in secondary care. The initial 120 medicine report provided more than 25,000 individual data lines. A succinct, replicable process has been set up, and this has enabled the timely production of a variety of tools for the data reporting of medicine stock levels across secondary care in Wales. This has included an antimicrobial stockholding report, a T20 stockholding report of critical medicines, and a main stockholding report, which since development has been expanded to incorporate medicines used in the treatment of COVID-19, for example dexamethasone, as well as providing specific reports for particular groups of medicines, such as those used in the end-of-life care.
Hello.
My name is Gail Woodland and I head up the One Wales Medicines process in AWTTC. The One Wales Medicines process was established just over 5 years ago to offer an alternative access route to medicines in Wales for those medicines where the health technology appraisal process was not possible, but there remained an unmet clinical need for patients. During the pandemic in 2020, we were contacted by clinicians working in the field of prostate cancer to see if we could review access to oral non-chemotherapy treatments for patients with metastatic hormone-sensitive prostate cancer. We were able to push through a review of these medicines in under a month, much faster than our usual 2 to 3 months process. This resulted in over 300 people gaining access to these treatments, keeping them out of hospital and hopefully reducing their risk of contracting COVID. We recently presented our findings at an international conference. If you're interested in finding out more about us, then please visit our website. We hope to attend a future PAPIG in person to discuss the role of patients in the One Wales process and how we can keep moving forward to ensure that we have our patients having a central role within the One Wales Medicines process. Thank you for listening.
So thank you to Richard Boldero, Senior Pharmacist, Wendy Casey, our Medicines Access Efficiency Project Manager, and Gail Woodland, another Senior Pharmacist, for putting the video together. Next, we'll be moving on to the main theme of this PAPIG meeting, which is communication and engagement. And our communication and engagement officers, Liam McKenzie and Jess Rayner, will now tell you about our new communications and engagement strategy, specifically focusing on our plans for engagement with patients and the public. So thank you, Jess and Leah.
Thanks, Claire. Good morning, everyone. So as Claire mentioned, I'm going to be presenting the communications and engagement strategy, which was put together by my colleague Jess before I came into post, which was about a month ago. So just before I move on to the first slide, I just want to mention the key messages. So the key messages of the organisation consist of that we are the leading authority in therapeutics and toxicology in Wales. So we play a pivotal role in shaping the medicine management agenda in Wales. We are a multidisciplinary organisation, so the AWTTC and AWMSG are multidisciplinary teams made up of loads of highly skilled experts, and then we are working towards creating a healthier, better informed Wales. So on the first slide here, I have the 3 key objectives. So there are 3 key objectives of the comms and engagement strategy that we're going to work towards delivering, or we are working towards delivering. So that's better outcomes for patients, reducing harm, improving medication, and supporting the delivery of values-based healthcare. So the focus will be on communicating the work of the multidisciplinary teams in helping shape the medicine management agenda in Wales, which supports NHS Wales in getting the best outcomes from medicines. Therefore, this strategy will identify a phased approach to communicate and engage with a broad audience across Wales and the UK. So there are 4 overarching aims, and they're all kind of self-explanatory, but I'm just going to go into a brief bit of detail into each of them. So we support the delivery of key objectives. So as aforementioned, the focus of the strategy will be to support the delivery of the AWTTC work programme and the 3 key objectives which were outlined in the AWMSG Chair's remit letter. To inform and raise awareness of the AWTTC and AWMSG, so that will be done by raising the profile of both of those through different communications channels and methods, and then to communicate the work of these in an effective and timely manner. Thirdly, we have to engage and involve relevant stakeholders. So that can be done through a combination of communication methods and channels. So key stakeholders will be invited and encouraged to engage in ongoing dialogue to ensure that the work is being implemented with impact and reaching relevant audiences. And then finally, we have to build recognition and retain engagement for the work of both AWTTC and AWMSG. So they're all kind of slightly similar, but all different in their own ways as well. So that one there will be to build recognition and awareness for the multidisciplinary organisations as leading authorities in therapeutics and toxicology through Wales and further as well. So looking now, whilst there are three main audiences of which we are engaging and communicating with, which are mentioned in the communications and engagement strategy. So that is the patient and the public, clinicians and healthcare professionals, and then the pharmaceutical industry. Obviously, for the purpose of today, we're just going to focus on the patient and public side of things. So there are specific aims aligned to each key area of work. So the aims being that of to build a diverse pool of lay members. So that will be done by reviewing and improving the recruitment, selection and support process for lay members, serving on AWMSG, PAPIG and NMG, and to ensure that there's a wide and diverse pool of members as well. The second aim is to establish links with patient-focused organisations and to build awareness of the work of the AWTTC and AWMSG. So that will be implemented by establishing close links with a wide range of patient organisations, charities and patient engagement teams. So in order to identify opportunities for patients and the public to share feedback and to take an active role, which we really value. We will also increase awareness of work and processes through methods, for example, creating a hub of resources on the website, which Ruth mentioned, and the AWTC and AWMSG websites are being merged, and then involving people in panel discussions, webinars, and collaborating on awareness campaigns. And then the third one is to raise awareness of the work of AWTTC and AWMSG to the general public and patients across Wales. So that looks kind of similar to the second one, but we're not looking at patient-focused organisations, it's to the general public and patients themselves. So we'll do that by building recognition of the work of the AWTTC and AWMSG through different areas of preferred communication methods and supporting campaigns like Your Medicines, Your Health, amongst the general public through targeted communications, PR, marketing and advertising activity. So what have we done so far? So far we have increased the lay member pool, but we are always looking to increase that even further and diversify it. We have improved our digital communications across a range of platforms. So we regularly update the AWTTC Twitter accounts and the website with news and information on work that we're doing and have done, and also press releases go on there as well. And then we recently signed the Royal College of Pharmaceuticals Inclusion and Diversity Pledge. So information like that goes up there, kind of everything that we're doing. Yeah, and then we recently established an internal patient organising committee. So that's responsible for organising activity surrounding the patient and public audience like yourselves, as well as arranging the PAPIG meetings throughout the year and making sure that they run smoothly. Our Welsh language standards have been reviewed to ensure that all of our content, be that on our website, social media and marketing collateral, any agendas, for example, are accessible to those who communicate through the medium of Welsh. And we have also collaborated with patient groups. So moving on to plans for the future. As I mentioned on the previous slide, we want to continue to increase and diversify our pool of lay members. And with regards to that online survey, over the next few months, I'm going to be putting out several online surveys. So that will be for each audience. So the three key audiences, but with regards to the patient and public audience, I really think that that would be vital to kind of gauge the level of interest and awareness that people have in the AWTTC and AWMSG, so that I can start to focus the communications, and because there's no point in telling people what they already know. We also plan to develop case studies, information videos, and online resources. So we want all the information to be accessible to you as possible. So we'll provide information on the work that we're doing and planning to do, as well as ways in which you can get involved with us and feel valued as well. So that this will be available across a range of media channels and platforms. We will continue to connect with patient organisations and identify further collaborative opportunities with other patient groups. and to maintain and develop our relationships with already made ones as well. So that includes the likes of Healthwise Wales, NIHR, Community Health Wales, Involve, and other groups as well. So just moving on to my last slide, I'd like to thank you all very much for listening to my presentation on the comms and engagement strategy. Jess is also here as well, so we would welcome any suggestions or comments or questions that you may have on the strategy. But it's really important to us that you do comment and get involved, because, you know, we're kind of doing this for you, so it's great to get your opinion on things as well.
Thank you, Leah. Has anybody got any questions or anything they would like to raise to Leah and Jess about the strategy and about, you know, how we should communicate and engage with our kind of patient organisations and public, you know, stakeholders, because you know, as Leah has said, we want to do what is best for you, and so any discussion would be very helpful for us. Well, I've got one question for you, Leah, just to kick off. So you mentioned earlier how one of the key messages is to create a healthier, better informed Wales. In which ways do you plan to promote this and engage patients and members of the public?
Okay, thank you, Claire. So when you look at it, all the work of the AWTTC and AWMSG is focused around this. So from the equity of access to medicine to the work being done on the Future Generations and Wellbeing Act, which I believe Carolyn's going to speak on later. So I kind of envision that as a wider piece, consisting of advertising, marketing activity, for example, 6 sheets, banners and posters placed in like high footfall areas around the UHB estates, as well as targeted social media content, like visuals, graphics, and the likes of GP surgeries, hospitals, and at the moment the vaccination centres obviously are very prominent as well. So all of those avenues will provide information and awareness surrounding the work of the AWTTC and AWMSG, and highlight how you can get involved with meetings and engage with us on our social platforms.
Thank you, Leah. Would anybody else like to ask anything at all? Please just wave your hand if you would, or if you'd like to share, especially from the patient organisation representatives, any kind of experience that you have had which you think, you know, we could actually learn from, because obviously your key role and remit is working with patients, and you know, is there anything that we could learn from what you do?
Can I just say something, about PAPIG and information to the public, patient and public. It's good to meet in meetings, which is in Landoc, as you know. It's not that easy to get to for everybody. And I'm on here now because it's a Zoom meeting, which is actually brilliant for people outside Cardiff. And you say you cover all of Wales, although you know, Cardiff and the Vale seems to be your base. And I think if we're not careful, we'll think of you as just Cardiff and the Vale. Like I said, meetings are just in Llandoch. And like I said, I've missed quite a few in the past, but I'm getting there, which is not easy. So we need to, if you are all of Wales, you need to start spreading it a little bit better, you know, to get to the rest of Wales, because they always feel cut off, especially North Wales or whatever. It's always been a difficulty, I know. I mean, I live in the Cwmtaf area, very interested and have been from the beginning with PAPIG, for the fact that I do take, I've got some comorbidities and I take, I'm immune suppressant and I take biologics, and I did a presentation once for PAPIG and for their pharmacists. I don't normally put my name forward for that, but I got pushed a bit by Richard, so I did it. But because I ended up with hydrochloroquine for 2 weeks in hospital and all that sort of thing. So I think it was appreciated. But my main thing was to say actually the accessibility for people outside of Cardiff, really.
Yeah.
We could work on that.
Yes, thank you, Jan, and that's a very good point. And it was one that, you know, we were kind of aware of, that we are very Cardiff centric and have been. And in fact, you know, I mean, I know the pandemic has been devastating for a lot of people, and it's also presented a lot of challenges, but one thing that has come out of it is actually having to embrace this kind of virtual world. And I think, you know, and it does work very well for things like this, where we want to target a wider audience and perhaps could come to us. So we are looking at going forwards with PAPIG, and we will be asking you this as well. We've got a short survey to send you after this meeting for feedback. And one of the questions is, you know, whether going forwards, perhaps we should focus more on the virtual meetings, or maybe have a balance of both virtual and online, or perhaps, you know, mainly do it virtual, but perhaps one face-to-face meeting a year, which we then could, you know, go throughout Wales with. So yes, we're very much kind of wanting your feedback on this about, you know, how we should take PAPIG forwards. And one of those things is, you know, the balance between a virtual and a face-to-face kind of meeting. So thank you. That's a really good point that you've raised, and yes, something that we will be addressing. Hello, I can see Claire has also got her hand raised. So,
hi.
Hello, Claire.
Hi. Yeah, it follows on really in terms of accessibility and so on, the points that Jan just raised. I think a lot of organisations, because Wales is sort of on the road out of the restrictions from the pandemic, and lots of organisations are turning thoughts now to how to carry on with various different meetings and groups and things like that. We've all now experienced the virtual type setups. And I think there is a balance to play in terms of online and face-to-face. I think a lot of Wales-based organisations do run the risk of being Cardiff-centric, even though we are supposed to be all Wales. So we should be spreading our meetings around. So perhaps the balance is to do, you know, sort of almost like mini road shows around Wales, where you can do face-to-face and then a mix of virtual. And the reason I'm saying that really is because one of the issues that has come up in terms of virtual and online is the thing called the digital divide, because not everybody across Wales gets good enough broadband access and broadband coverage to participate in the virtual meetings. So for the number of people who find it difficult to travel and get to face-to-face meetings, so therefore appreciate virtual, you've also got the balancing act of a number of people who can't get virtual because they don't have the broadband strength, so therefore appreciate face-to-face. So I think you've got a balance to play, and I think a lot of organisations like AWMSG, like AWTTC, are facing that question now, is how to get the mix right.
That's right, going forward. I don't know if Ruth wants to just jump in here, because before the pandemic actually interrupted life as we knew it, we were looking at this as well for, as you say, we're an all Wales organisation, for our main committee, which is AWMSG. And again, we were, you know, thinking about how that could be more kind of, go out to more places in Wales. So Ruth.
Yes, as you say, Claire, we just before the pandemic hit, we were about to take the show on the road, and our plans were halted. But recently we emailed out to all AWMSG members to say that we're thinking about this now. How do you feel about face-to-face meetings? So we're having those conversations. It's still early days, but I think we like this blended approach. There's nothing quite like having a face-to-face conversation and looking somebody in the eye and having opportunity over a cup of coffee for for more discussion. I think that's important. What we want to make sure that we're available for those types of conversations, and so I think a blended approach might be the way forward.
Yeah,
but we'll appreciate all your comments after the meeting in the poll.
Yeah, definitely. And also, please feel free if you you know, don't want to speak, which is fine. There's a chat function on Zoom as well. So if you've got a question you would like me to ask on your behalf, then please just put it on there, and we'll either ask it now, or if time doesn't permit, we will get back to you with an answer. So anything else anyone would like to raise at all? Okay. Oh, thank you anyway. Well, that's great to have those views anyway about, you know, obviously where we hold our meetings. So what I'm going to do now, I'm going to just say that as Leah and Jess have said, or Leah has said, we will welcome any feedback about the new strategy. So either feedback to us now using the chat, as I've just mentioned, or if you prefer, you can email us anytime at awttc@wales.nhs.uk. So now I'm going to move on to the next item on the programme, and I'm delighted to introduce our external speaker, Mr. Rob Lee. So Rob has been a PAPIG member for many years through his work as a community champion with Diabetes UK, and he is also the Vice Chair of the All Wales Diabetic Patient Reference Group. I've got that right, have I, Rob?
Thank you.
Thank you. And Rob will be talking about his experiences of patient engagement from the other side, if you like, and also how getting involved in the work of AWTTC has benefited patients with diabetes in Wales. So over to you, Rob. Great,
thanks very much. That's really good to be here. I've just had a few problems getting in this morning. I hadn't got the link for some reason, but it's technology for you. Yes, I've been a member of PAPIG. Oh, I can't remember how long now, but it's a long time. I found very, very useful to see from the point of what the work of the AWTTC is doing, and this engagement with patients as well. And I think it's a really good way forward. And I'd just like to share some things this morning about my involvement and what I've been doing with the All Wales Patient Reference Group, and also with Diabetes UK. So I'm retired now. My background is pharmaceuticals, but I'm retired now, but I work harder now at this patient engagement, so which is really good fun. But just to let you know, my name is Rob Lee. I'm the Vice Chair of the All Wales the Diabetic Patient Reference Group. I'm a community champion for Diabetes UK, and patient engagement is on my agenda, and it's been really difficult over this pandemic to engage with people. Can I just share my screen, guys? Is that okay?
Absolutely. Go ahead.
Yeah, okay, here we go. Just make sure you can see this, guys. Just tell me if you can. Let's put it onto screen view. Can everybody see that? Is that okay? Just stick your fingers up, hands up.
Yeah,
yeah, that's great. Thank you very much. That's me. My name's Rob Lee, and we're part of the. And I just noticed that one of our members here that we've also got one person from Jani's here from the All Wales Diabetic Patient Reference Group, and that's great to hear her talk. And my hope is that some of the guys from the from PAPIG or the ATTC will come and actually come and talk to us in our group as well. That'd be really good to have. Great. So just to say what we've been doing during this pandemic, it's all about the patient voice, and it's putting patients right at the very center of the care that we have. And I celebrate what PAPIG is doing here. So the patient voice is so important. And if we not putting in the patient at the center and making sure that we're engaging, we can't get our services, our health services we cannot just be delivered health services. We've got to have feedback from our patients. We've got to see what they want. and it's particularly in diabetes. Now, I've got diabetes, and I've had it now for 15 years, and I take insulin, and I am dependent upon the health service to provide me with my medication, and it's, you know, I am grateful for that, so just a comment here from the Diabetes Quality Statement. This is coming out recently. Empowerment and knowledge of people living with diabetes is, let me just remove my, my thing so I can actually see the rest of it. That's the only problem with Zoom, isn't it? It's central to the effective care and optimization of treatment pathways throughout life journey with diabetes. Self-management and involvement is the cornerstone of diabetes care. So it's enabling people. It's making sure that we are involved with people. We know what's important to patients, and giving them the tools and the services. And there is a culturally sensitive part of that too. So we, as a diabetic patient reference group, engage with the BME community. We're engaging with care homes. We're engaging with young people. So we've just got to make sure that we are we've used social media during this this pandemic. We've used Twitter. We've used any means that we can actually use to communicate. And we have to use different ways with different people. And that's a key message, really. Diabetes, as Janice said, requires a lifestyle approach, especially type 2 diabetes, and there are many comorbidities. Multidisciplinary teams need to be involved and community services. So it's an engagement on a wide level, and we need to be doing that. But the big question for me, what is important to people? What is important to patients? What is there? Let me give you an example. Something that's not commissioned by the health service is this nail cutting for patients. Now, one of the big problems we found in this pandemic is that people are not getting their nails cut. Now, I can see a clinician saying, well, that's not my concern, you know, they can get, but it's been a real problem. But, you know, if you're not getting the nails cut, that is going to be a clinical problem down the road, especially with somebody with diabetes. And, you know, you could end up with an ulcer. So we've done some work, just pulling, again, a lot of agencies, a lot of charities together who do that social nail cutting. So it's what the patient really is important to the patient. And that was so important during this pandemic. I hope you can see it. Any questions on that, I'm really happy to take afterwards, okay? So I've been working with AWTTC, All Wales Therapeutics and Toxicology Centre, and PAPIG for the last, I can't remember, it must be 5 years, 6 years. It is good to engage with people and just to make, it's important, guys, that we get involved and let them know what's important to patients. It's honestly, if I can encourage you to get involved with these people, it's really good. You know, we have to use different platforms going forward, and talking about online stuff and Zoom and Teams and all that. It's good, and it's been a real opportunity for us as a patient reference group to use Zoom and Teams. So the voice and views of people with diabetes is important, and we, as an All Wales Patient Reference Group, run peer support groups around the country and have health board reference groups. So these people, like Jan, influence a lot of other people. And that's how we've been operating. And during this pandemic, we've worked harder than ever. It's been fantastic. We've had more meetings. I don't have to travel up to Mid Wales to have a meeting with people. Wonderful. But people do miss the face-to-face. On the counter side of that, we have recognized the digitally compromised people and those who cannot engage in this sort of way. We've had represented national and local service implementation groups across Wales. We've consultation on diabetes plans. We've got the services back up and running for diabetes, and the patients have been key in doing that and giving the patient perspective, what's important to patients. A big part of our work is also now concentrating on the young adults with getting their voice. This is an area that's missed out. And young people often are on their own. And guys, this is the future for us. You know, well, many of us I'm getting a bit crinkly at the edges now. And but the future for us is this group of, we're concentrating on 18 to 30 who are often missed out in our talking to them. So we've engaged in Twitter, we've engaged on social media, we're putting together Facebook pages and things like that, just to make sure we're getting information and engagement from that group of people. And they often feel, believe it or not, young adults feel isolated. And getting their views is really good, and it's really helpful to them as well. I mentioned the BME voice, so we do engage with the Black and ethnic minority groups and that's been an important because we have different ways of engagement, and we have different issues that are brought up and different ways of communication. So we've been involved with other health charities, and that's really, and I am so pleased today that there's so many representations from a lot of groups around from around Wales. It's so good to have you on board, guys, and just contact, and it's about sharing best practice, you know, and PAPIG really does bring that together. We can share best practice, what we're doing in our charities, how we're engaging patients, how we're engaging with the health services. One of the big achievements that we've done is to provide, during this pandemic, is to provide a report of how patients feel about COVID and how they're controlling diabetes. That has been, and how are they coping? That has been a big eye-opener. Let me just move my screen a bit again. So yeah, like I've said before, we've been involved in the post-COVID return to diabetes services. Okay, just moving on. So we meet every month on Zoom, and we will be meeting together eventually, but it has been a great way of meeting, but it's not, okay, it's not right for everyone. And we've had to follow up with phone calls, we've had to follow up with emails to the patients that we're not getting. We produced a newsletter as well to communicate. So we've done some work with care homes, and we are coordinating that work as well. We've done some work on the individual care plans in Wales. And one big area that is the major concern for us is getting iServices Wales diabetes. And I see people here, I hope there's some people from RNIB here or Site Cymru. It would be really good to engage with you on these things. We are lobbying for getting those services back up and running. There's a massive backlog, and we are lobbying government, we are lobbying health services, and we've become a bit of a lobbying voice, which is so good for our groups. And that's a possibility with PAPIG as well, that we can see change. So we've said involvement of young adults, keeping in touch with peer support groups. Not everybody likes Zoom, but hey, we use other methods as well to get in touch. I've talked about my podiatry nail cutting service during COVID, and we've talked about the report that we've done on diabetes. So just some take-home points. I want to finish there, and some this is a message to all managers. It's all health workers. We're all patients. It's all patients. We're all patients. So we do access. So putting on your patient head sometimes when you're thinking about how would I structure that from a patient point of view? How would I want that presented if I was a patient? Yeah, thinking around those sort of things. Involving patients in our discussion, as PAPIG is doing, is so important. And getting better at our engagement. And I believe that's an evolving process, that we get better at doing what we engage in patients. Important that what's important to patients, I've said this time and time again, and there's an adage here, no decisions without me, about me without me, and that is so important. We've got to have that as a mantra. Yeah. So I want to encourage you to get involved with PAPIG going up forward, and I found it great benefit. Use a lot of their data, and we're hopefully now going to get some of these guys from AWTTC can come and talk to us as well. So thank you very much, guys, and I hope that was okay. If I don't know how you want to run questions here, Claire, I'm not sure. Yeah.
Thank you very much, Rob, for an excellent talk and you know, some really great examples of good patient engagement, which you know we want to learn from as well. And you know, I just want to re-emphasize what Rob is saying. Please get involved with us. You know, patients are at the heart of what we do, and we need to know kind of, you know, what you require as well as, you know, everybody else, the clinicians and stuff as well. So please do get involved with us. So thank you, Rob. That was really good. And you know, as you say, you know, sharing kind of experiences makes it, you know, makes us all kind of stronger in doing our engagement. So thank you. Has anybody got any questions for Rob at all? I think we've got a couple of minutes. We're going to go for a short break in a minute, but if you again would like to use the chat function, we can you know, send these to Rob later if you like.
Yeah, I can pick up some of the chat. I've got the chat on the side, so I can answer some of those. Yeah.
So, but no, thank you. Oh, hello, Jan.
Just a quickie from me. Rob.
Hi, Jan. How you doing?
Hi, Rob. Rob is brilliant and very much involved with the diabetes group. He uses Twitter. Guess what? I don't. I'm obviously not quite got to that stage. I've passed that in my life. But Rob is very tech, you know, so he helps us along very much in that way as well. The one thing I'm going to say, and I'm going to say it quickly because it highes my blood pressure and I don't want more problems than I got already, to do with self-management. We need to self-manage. There's no other way. There's no magic wands out there. We need to do it, and most people want to do it. But to do it, we need the tools and the information. And as much as all these care plans and all these statements and all these things that come out and all the rhetoric, which drives me completely insane, saying all these things, but it's not happening. We're not being given the tools. We're not being given the information we need. And it's not good enough. And as we say for the sake of my blood pressure, I won't go on anymore. But then Rob knows what I feel about it and our recent care plans and et cetera, and we keep fighting on. But I must say, I'm starting to wane a bit now and again. So
thank you, Jan.
I'll keep going a bit longer, Rob. Thank you.
We'll keep going, Jan. Yeah.
Oh, thank you, Jan. Yes, you know, an important point, isn't it? That you know, we want, well, the health service, you know, it's a collaboration, isn't it, between the patient and the clinician, and you know, patients do need. I
agree with Jan to some extent, but I do recognise that, and I know that people from charities, you do have to make plans, you do have to put it down on paper, you do have to have documentation, and you have to have consultation, and I do realise that's part of the work of the AWTTC. And that's necessary. And when we're working professionally, we have to have those. And patients, to a certain extent, find that, oh, wow, how am I going to comment to this? But when I do it, I always take off my health service hat and make sure I've got my patient hat on and just say, hi, if I was given £250,000, or £1 million, as some of the services have just been given by that. What would I do with that money? How would I improve the life of patients? You know, and it's often good for us to do that, for everyone as a patient. You know, to think, how would I do that? We have to look at documentation all over the place, but that's how I come to it. Great.
Yeah, it is. It's a tricky one. Anyway, time is ticking on. I think we could probably all do with a short kind of comfort break, grab a cool drink as well. So the time, I've got various devices here, all with different times, but I'm going by my phone. The time is 10:26. So if we meet back here at 10:35, and we'll continue the rest of the programme after that. So see you in a bit. Thank you. Hey, I make it 10:35 by my mobile. So welcome back, everyone. I hope you've all had a chance to get a suitable refreshment. So I'm going to launch straight back into the programme with the next presentation, which is by Carolyn Hughes, who's one of our lead medical writers. And she will be talking about how AWTTC and AWMSG will be working to achieve the goals set out in the Wellbeing of Future Generations in Wales Act, which you might be familiar with. This will be directly followed by Richard Bolderow, one of our senior pharmacists, who will be then talking about a particular project looking at reducing the environmental impact of inhalers. So I will just now go to Carolyn's presentation.
The Wellbeing of Future Generations Act requires public bodies in Wales to think about the long-term impact of their decisions, to work better with people, communities and each other, and to prevent persistent problems such as poverty, health inequalities and climate change. The Act offers a huge opportunity to make a long-lasting, positive change to current and future generations. The Act sets out 7 wellbeing goals. These focus on a Wales that is prosperous, resilient, healthier, globally responsible, and more equal, with cohesive communities, a vibrant culture, and a thriving Welsh language. The Wales we would want for the future generations who will live here. Public bodies in Wales must work to achieve all 7 of the goals, not just 1 or 2. We've written a report that highlights how AWMSG's work plan relates to each of the goals. It gives some examples of AWMSG's work so far, and we also set out the actions we think we should take to achieve the goals. You'll have heard in today's meeting about communication and engagement, and of course these play a big part in our achieving the wellbeing goals, as well as our responsibilities as a public body. I've focused on just a few of the communications objectives here, as they will help us to achieve a healthier and better informed Wales, and a Wales of thriving Welsh language. And engagement objectives. These will help us to make sure that every project is developed with a clear plan for the future, that we collaborate with other organisations and actively involve people in our work, and help us to achieve a Wales of cohesive communities. Our report contains all of our objectives to meet all of the wellbeing goals. We'd like you to take a look at our report, particularly our plan of actions, how we can involve people in our work, and a checklist that we've started to develop to make sure we take into account factors such as equality, diversity and sustainability at the beginning of a project. These aren't finished yet because we'd really like to hear what you think about our plans. We'll send our draft report to you after the meeting, along with a feedback form for you to send us your comments. I'm now going to hand over to my colleague Richard, who's going to tell you about a project that will help towards a globally responsible Wales and tell you how you can get involved. Thank you. Diolch.
Okay, and now over to Richard.
Thank you. So one of the main focus areas with regards to the wellbeing of future generations is that around sustainability and the so-called green agenda. So AWTTC have been working closely with the Respiratory Health Implementation Group, RIG, looking at environmental impact of inhalers. This is particularly relevant to those which are known as the metered dose inhalers. So RIG has produced a poster, which Anne has very kindly just shared now for you, which is aimed at raising patient and public awareness of this issue. And they are very keen to have thoughts on this before it is rolled out further. Therefore, after this meeting, we'll be sending it out to you by email, and we'll include a pro forma for comments. Now, at the moment, because this is in draft form, there is only an English version available. But of course, the intention will be that once there is a more finalised version, then that will be obviously have a Welsh translation as well. So we hope that you will take this opportunity to be involved with this piece of work on behalf of the Respiratory Health Implementation Group. And we look forward to receiving your comments, which we will pass on to them. Thank you.
Thank you. I don't know if anybody's got any initial comments at all. I know you've only just seen the poster, but as Richard said, please feedback any comments you do have via the pro forma that we will send out after the meeting. So thank you very much, Richard, for that. Okay, so we're going to now move from matters green to matters yellow. Many of you will be aware of the yellow card scheme for reporting adverse reactions to medicines and vaccines. And the Yellow Card Centre Wales is actually part of AWTTC, and members of YCC Wales, so Jenna Walker, who's a specialist information pharmacist, Dr. Alison Thomas, who is the medical director, and Diane Burnett, the National Medicines Information Lead for Wales, will now be talking about the importance of patients reporting to the scheme, and also about the new COVID-19 vaccine allergy service here in Wales. So over to my colleagues from YCC Wales. Thank you.
Great, thank you, Claire. Can everyone hear me okay?
Yes, that's great, Jenna.
Brilliant. So I'm just going to start my slideshow. So hopefully you can all see my slides on the screen. So first of all, I just wanted to say a big welcome from all of us at YCC Wales to all of the members of PAPIG, both old and new. And it's really great to see so many patient organisations represented here and have the opportunity to speak with you. Now, it's been a while since our last meeting, so I thought I would take the opportunity to introduce the Yellow Card scheme in general and to explain a little about why it's so important. And then, as Claire said, I will spend a couple of minutes just letting you know about the National COVID Vaccine Allergy Service that has been set up. And that was really as a part of a collaborative project between the Welsh Medicines Information Centre and colleagues at AWTTC. So just to set the picture, I thought I would give you a bit of an idea as to how we fit in as an organisation. So here in the UK, we've got the MHRA, or the Medicines and Healthcare Products Regulatory Agency. And these are a UK government body who's got an overall responsibility of making sure that all of the medicines, the vaccines and the medical devices that we use here in the UK are safe for the people that are using them. I think it's safe to say that since the start of the COVID vaccine programme, the MHRA are pretty well known now, certainly in comparison to how well known they were before. And in order to help them with their role in making sure that medicines are safe, they run a scheme which is known as the Yellow Card scheme. Now, a yellow card is a way of officially reporting a side effect to a medicine to the MHRA. And it's referred to as a yellow card because historically the report was on a piece of yellow card, hence the name. And it is still one of the ways in which you can report a side effect to a medicine now, although there are other ways in which you can report, and I'll cover those in a minute. These reports then go into sort of a UK-wide database where the information can then be collated and then analysed and investigated, so that if there are any actions that need to be taken to make medicine safer, they can then be done. As I said, we work for the Yellow Card Centre Wales, and we are one of 5 regional centres which are funded by the MHRA to promote the understanding, the reporting and the research of side effects into medicines. And we also come as part under the umbrella of AWTTC. Now, when we're talking about side effects to medicines, this is the official definition. So a side effect is a response to a medicine which is unpleasant and unintended. And it can either happen when the medicine is used as is instructed in the patient information leaflet, or when the medicine is used off-label, which means that it's used for a different reason or in a different group of people than is listed in the patient information leaflet. It can also happen when the medicine is taken in overdose, if it's been misused, abused, or if there's been a medication error. Now, all medicines have side effects, and with any medicine, some side effects are more common than others. Luckily, the more mild side effects seem to be the most common. If we take penicillin, which is a really commonly prescribed antibiotic, for example, it's used by many people and saves thousands of lives every year. But this comes with side effects as well. So the more common ones tend to be the milder reactions, so rash, nausea and diarrhea. And these commonly happen in about 1 in 10 to 1 in 100 people. The more serious ones then tend to be happening a lot rarer. So if we take liver damage, that's a very rare side effect, which would happen in 1 in 10,000. Now, there's often a misconception that clinical trials find all possible side effects to medicines, and unfortunately they don't. Clinical trials tend to be tested, I guess, in about 1,000 to 3,000 people. And for a medicine that is, or for a reaction that is classed as rare, so something that would happen in 1 in 10,000 people, you would need to test that in about 30,000 people to be able to detect it with any sort of certainty. Now, the clinical trials are really good at detecting the common side effects, but they are less good at picking up those reactions that are more rare. And these are usually only picked up when the medicine has come onto the market. Now, the COVID vaccines are a really good example of this. And the COVID vaccine trials were actually tested in tens of thousands of patients. And the trials really showed that the COVID vaccines were generally safe for the vast majority of people. They were able to identify the common reactions, so things like headache, feeling fluey, having a high temperature, and these were picked up during the clinical trial process. However, they weren't able to pick up some of the more rare side effects. So I'm sure we've all heard of the very rare, very particular type of clot that has been linked with the AstraZeneca vaccine. And it's only thanks to people reporting these to the Yellow Card scheme once that vaccination programme had been rolled out to millions of people, that we were able to identify this and link it to the vaccine. And thanks to these reports, we have been able to then make changes to the vaccination programme so that it can become safer for the vast majority of people. So as we said, the Yellow Card scheme is really ideal and well placed to picking up these rare side effects that can be missed during clinical trials. Clinical trials often exclude certain groups of people, so those who have got multiple medical conditions or if they're taking lots of medicines, they're often not included in clinical trials. Clinical trials also don't include children for obvious reasons, and also those who are pregnant. So it's only when medicines are used in these people once they come onto the market that we're able to identify any possible problems. When we come to prescribing medicines, it is always going to be a balancing act. So we need to weigh up the risk of any side effects with the benefit that that is going to pose to your patients. And again, going back to the COVID vaccines, that's where the Joint Committee of Vaccination and Immunisation team come in, and they're able to weigh up these risks and benefits and help to provide some advice to the government as to how to roll out these vaccinations and which groups of people should be offered which vaccine. So if we take a look at this advert, so this is something that was taken from the BMJ from 1961. And you can see on here that the advert is telling you that the the drug is safe for use in children. Now, the drug that they're advertising is Distaval, which is actually thalidomide. And I'm sure a lot of you will have heard about thalidomide and the unfortunate effects that it had when mothers took this during pregnancy. Now, around the time of the 50s and 60s, there had been lots of reports to various journals throughout the world, alluding to a possible link between mothers taking thalidomide during pregnancy and babies who were being born with birth defects. But unfortunately, there wasn't really any organisation throughout the world who was able to link up these sorts of reports, which led to it being unnoticed for quite a while. And that's really why the yellow card scheme was sort of set up in the hopes that similar tragedies don't happen in the future. So the yellow card scheme is really important. It's really important for patient safety, and it helps us to identify any problems with both old and new medicines. As we said, new drugs tend to have a lack of experience about side effects, so it really helps us to build a picture as to what happens with these medicines, and it helps us to detect those rare side effects. Now, with the yellow card scheme, absolutely anyone can report. Since 2008, members of the public have been encouraged to report side effects that they experience to medicines, and also for reporting side effects to have happened to any of their children or somebody that they're caring for. And YCC Wales are really keen to try and increase the awareness of the yellow card scheme amongst members of the public, and we'd really value the opportunity to work with you and your patient organisations to get the message out to members of your groups as to the importance of yellow card reporting. In terms of what should be reported, so we divide them up into two groups. So some medicines are classed as new drugs, so they're marked with an inverted black triangle. And for these medicines, we're really trying to build a picture as to what happens or what side effects patients are experiencing. So these are given to new drugs, new combinations of drugs, new ways perhaps of giving that medicine, or new reasons for prescribing it. And for these medicines, we're inviting people to report any suspected side effect, regardless of how serious it could be. For all other medicines, so those that have been around for a number of years, we're inviting people to report those serious side effects. And when we say serious, this would be anything that interferes with your daily activities, and also anything that perhaps is not listed in the patient information leaflet. There's lots of ways to report side effects to the yellow card scheme. So the first is via a yellow card, and these would be the paper copies that can be sent to the free post address. You can get these forms from pharmacies or your GP. You can also download them from the website. There is a dedicated yellow cards hotline which you can call, and that goes directly through to the MHRA, so you can report your side effect that way. There is also an online form, and I'll show you the front page for the website in just a moment. And there's also the yellow card app, which can be downloaded for free, and you can report that way. Now here's just a screenshot of the yellow card website. So the main one that we usually talk about is the one that I've highlighted in red here, and that's how you report a side effect to a medicine or a vaccine. We also encourage you to report side effects to herbal or homeopathic remedies or medicines that you can buy over the counter, so it doesn't have to just be something that's prescribed by a doctor. On the website, you can also report any problems with medical devices. If you've got any suspicion of defective or fake medicines, that can be reported, as well as any side effects to e-cigarettes. There's also a button on here to take you to the COVID vaccine reporting portal, and that way you can report any side effects to any medicine that is used to treat COVID, or any of the vaccines that are used to obviously prevent COVID infection. We touched briefly on the importance of reporting, but when it comes to yellow cards, the information that we get from them is really important. And the actions that we can take to make medicine safer could include things like changing the patient information leaflet to restrict the use of a particular medicine. We could also use it to improve the warnings that's put in the leaflets. And in very rare situations where patient safety is compromised, then the MHRA could actually withdraw that medicine from the market. We do have a number of social media platforms. If I'm honest, we haven't been particularly active on social media over the last few months, but it's certainly something that's in our strategy to increase our following and increase our engagement going forward. So if any of you do have any organisations who are on social media, we would really value your input on how we can get our messages out there to a wider audience. I said I would just touch briefly on the COVID-19 vaccine allergy service, which has been established. And my colleague Alana, who was involved with leading on this project, was hoping to join us today, but unfortunately she wasn't able to make it. So she has provided me with some information that I'm going to share with you. So please bear with me, because these aren't my points. So the COVID vaccine programme was obviously commenced in December 2020, and in January we really noticed that there was a high demand of citizens who were seeking advice about allergy status and the safety of individual COVID vaccines for them. Within Cardiff and Vale, we were really lucky to have the support of the AWTTC allergy specialists, so Dr. James Coulson and Dr. Lawrence Gray, and they were really invaluable in helping us to provide advice to patients who were seeking this type of advice. Now, just to put into context how big the demand was, within February, the Welsh Medicines Information Centre received more inquiries within 1 month than we would normally do within 6 months. So it was a huge increase in our workload, and I don't think we could have done it without the support of Dr. James Coulson and Dr. Lawrence Gray. The provision of the allergy specialist advice was really good within Cardiff, but actually within the rest of Wales it was quite patchy, or unfortunately wasn't available, and that was leaving patients or citizens without the protection of the COVID vaccine protection. In May 2021, the Welsh Government really identified this as a gap, and they commissioned a joint allergy service between the Welsh Medicines Information Centre and the allergy specialists for a period of 6 months. In order to minimise the risks, we implemented a COVID vaccine service database and an electronic request system, which enabled people from across Wales to access our service. And this was really supported by WAL at AWTTC. We're also supported by staff at AWTTC with handling the data. So it really is a collaborative approach. And just to let you know that the service has been really successful. And since January the 1st, we've managed to help 2,194 patients access their COVID vaccines in a safe manner. So that was just a bit of a brief overview of the allergy service that's been set up. We're very happy to take any questions now, or you can get in touch with us at a later date. But yeah, that's it from us. Thank you.
Oh, thank you very much, Jen. That was a really interesting and informative presentation. As Jen has said, has anybody got any questions at all they would like to ask about Yellow Card Scheme or about the allergy service as well? Did I hear someone there? No. Well, to say anyway, if you do have any questions or you want to ask anything, then please feel free to use the chat function, or you can email us later. But just oh, hello. Hi, Rob.
Hi. Can I just ask, you did have an app actually for the Yellow Card system. It's not been developed anymore. It was a bit cumbersome, the app was. Is it still up and running?
Yep, so there is the Yellow Card app, which you can either get on Android or on your iPhones. it has been developed and they are constantly updating it. So hopefully it's a little better and easier to use than it previously was. And they are still asking for any feedback. So if you do have any further comments, then pass them on, and I'm happy to badger the MHRA to make any future improvements.
Okay, thank you.
Thank you. Okay, just to re-emphasise what Jen was saying, please, encourage your patients in your organisations to report, if they do experience adverse side effects from any medications they're on. Okay, well, next up we have Claire Ganderton, who is a senior pharmacist with AWTTC and also our Horizon Scanning lead. And Claire is going to explain a little bit about a project she is leading on, looking at ways to improve how we plan for new medicines entering NHS Wales. So over to you, Claire.
Thank you. Just getting my presentation up. Can everybody see that my presentation on screen? Have I done that right?
You have. Brilliant.
Brilliant. Oh, you're never quite sure. So yeah, thank you, Claire, and good morning, everybody. As Claire said, I'm one of the pharmacists within AWTTC. One of my roles is as the lead for Horizon Scanning. So over the next 5 minutes, I'm going to give you a very brief introduction to Horizon Scanning and let you know about a new project we're going to be undertaking relating to this. So when we're talking about Horizon Scanning, we're talking about looking ahead to see what medicines might become available in the coming months or years. And we do this to help the NHS to put the necessary plans in place so that these new medicines can be made available to patients that need them in a timely manner. So we're looking at medicines that are still in clinical trials and not yet licensed. And it isn't until the medicine has received its license and been recommended for use by NICE or AWMSG that it can be made routinely available to patients. So, and we're looking at new medicines or medicines that are already available, but the license has been extended to a larger group of patients or a slightly different use, and new formulations of existing medicines. So how do we know which medicines are in the pipeline and their potential impact? So AWTC uses a range of resources. So we've got reports, information from other Horizon Scanning organisations across the UK, databases, communication with pharmaceutical companies, input from clinical experts and senior pharmacists who are working in NHS Wales to work out things like when the medicine is expected to become available, how many patients are likely to receive this new medicine once it's available and recommended for use by NICE or AWMSG, and the associated budget impact, and whether any changes to how services are provided are needed before the medicine is able to be prescribed to patients. So for example, is there any extra clinic or staff time needed, or perhaps a new diagnostic test that isn't currently available? So as I said, one of the resources we use are clinical experts who are working in NHS Wales, and we identified that there were some unanswered questions around this part of the process, and I was fortunate enough to be successful in applying for funding from RCBC Wales to undertake a project to look at this. So more specifically, the project is going to look at to gain a better understanding of what information clinicians in Wales need about medicines in the pipeline and how those needs might be best met, and to look for better ways for AWTTC and clinicians to work together to improve how the NHS plans for new medicines in Wales. So we're going to be sending out an online questionnaire to clinicians in the autumn, just going through the ethics approval process at the moment. So yes, we're aiming to send that questionnaire out probably in about October time. But it's important to us that patients and the public are able to input to all aspects of our work, including research. And whilst patients and the public are not involved in this project as participants, there is still an important part that you can play in this. So, for example, reviewing the latest summary of the results, disseminating the project findings, looking at the implications of the results, sort of considering change that might be needed. So if anyone on the group is interested in getting involved, or if you have any questions, please do get in touch. that's all I had to say. So thank you and diolch yn fawr. I'm now going to hand over to Dr. Lynette James, or Wales Patient Safety Lead, who's going to be letting you know about another study that's upcoming. Remember to stop sharing.
Thank you, Claire. Is Lynette here?
Yes, I'm here.
Oh, hello, Lynette. Hi.
Hi. Yes, so thank you very much for inviting me to the forum today to give you a bit of an insight into some research that I'm conducting with collaborators from the School of Medicine and the Cardiff Metropolitan University as well. And it's an opportunity, should you wish, to be involved in that work. So in June, I received funding from Welsh Government Pharmacy Delivering a Healthier Wales to develop resources to support a steroid advice service. So the research study is divided into two parts. The first part is the development of the resources, and then the second section is the evaluation of these resources in real life use by patients. So we're currently in the process of applying for ethics for the first section of that research. The application has actually gone in this morning at 5 to 10. So that's where I was first thing this morning sorting out that. So that aspect of the study involves the development of resources for both pharmacy staff as well as patients. It involves conducting virtual focus groups with patients or individuals who are taking steroid medication or have taken steroid medication in the past for long periods of time. And the aim of those virtual workshops is to extract really from patients what they really want in terms of resources, to co-design and co-produce resources then that meet patients' needs and give them the best information possible in an accessible form for them that informs them on how to use their steroid medication and to manage their condition. So part of the collaboration also involves the design team at Cardiff Metropolitan University, who will be then taking the ideas that the participants of those virtual focus groups have shared with us, and they will then create the resources in whatever format the participants think are suitable. So whether that be leaflets, whether it be an animation or graphics or videos, whatever the patients come up with, then they will use their creative skills to produce those materials. And then about 4 to 6 weeks later, after they've had an opportunity to design that material, there'll be a follow-up focus group where the material will be presented to gain some feedback on what they've produced, so that we can then tweak it. And then the second half of the study then will be using these materials in real life then, where they will be given to patients by pharmacy staff, and they'll also be available on a website, so patients will be able to access them in a variety of formats and use them then. And then we'll be evaluating with those patients that use the resources to see what they truly think about those resources. Have they actually used them in their real life setting? Has it made a difference to them in terms of the way that they use their medication and the safety of using those medicines as well, whether they've known exactly how to manage their condition to get the best outcomes as a result of having those resources there to support them. So as I said, the resources that are being developed, they are specifically targeted at those individuals that use corticosteroid medication, so whether it be as inhaler, whether it's tablets or nasal sprays, creams, ointments, etc. There are specific patients that use those medication, their life depends on them. So they are the Addison's patients and those with pituitary disease who are totally life dependent on those medication and get their medication normally from endocrinology specialists having been diagnosed with the condition. But then steroids are used for a broader spectrum of other disorders and conditions like rheumatological disorders, like asthma, gastrointestinal, inflammatory bowel disease, skin conditions, and so on. So that broader population group may not be as well supported in taking that steroid medication. Hence, we have got involvement from the Addison's and pituitary patient groups, but that's why we're coming to a much broader patient group as well, because we're more likely then to pick up that broader population of patients who are taking steroids to manage other disorders, which, and the steroid isn't a kind of a life-dependent medication for them. It's there to manage their underlying inflammatory disorder. So that's why we've come here today to find out really whether this would be something that as patients involved in this patient involvement group, it would be something that you would be interested in. And then if you are interested in kind of sharing it with your membership, then what we can do is the recruitment emails and invites can be sent then to the PAPIG group to disseminate onto you then to share with your patient populations, that we capture this broader patient group as part of those virtual focus groups, because the needs of that broader population group may be different to those who have to take that medication in order to survive. Without it, they would die. So we understand that the needs may be different and the challenges may be different. So we need to ensure that we encapsulate everybody when we develop these resources. And that's pretty much it for me. Is almost asking your permission if you're happy for us to send information your way once, with the recruitment emails and so on, once they've been rubber stamped by ethics.
Okay, oh well, thank you, Lynette. And I can see from the chat actually that there is some interest in participating in that from some of the representatives of patient groups here already. So in terms of then getting you that interest fed back to you, shall we put information on the email that we'll be sending to all participants after this meeting with contact details for you if they want to find out more?
Yes, that you can do that. Yes, if there are any patient groups a part of the PAPIG group here that that they can see the relevance of this to the populations that they represent, then yes, you can contact me by email, and then I can include you then as part of the recruitment drive then for patient involvement in those groups. And we're also looking at all ages as well, because steroids are taken by a broad spectrum of ages, from youngsters all the way through to the elderly as well.
Great. Okay, so yes, so people who are interested, then Lynette's contact details will be on the email. So if you want to follow it up, then obviously, get in touch with her. So thank you both to both Claire and Lynette for telling us about two very important projects. And as I say, please do get in touch if you are interested in participating in either of those. Okay, well, we're moving towards the end of the programme now, and finally, and as a slight change to the programme, I'm now going to hand over to Tom Curran, who is a senior scientist at AWTTC, who will be talking about the medicines optimization area of work that AWTTC supports, and this will include our recent publications, the newly produced medicines optimization framework, and most importantly, how you can stay up to date with what we're working on and get involved in the work we do. So over to you, Tom.
Thank you very much, Claire. Hello, everybody. So just bear with me while I share my screen quickly. Hopefully everyone can see that. Okay, so I'm Tom Curran. I'm a senior scientist who works at AWTTC. And I'll just be talking to you about the medicines optimization work that AWTTC is involved with. So when we talk about the work that AWTTC supports in terms of what then goes through the All Wales Medicine Strategy Group, it can be summarised into two main work streams. So we have our health technology appraisal work, which is ultimately All Wales Medicine Strategy Group making recommendations to Welsh Government on what therapies should be made available on an All Wales basis. But then separate to that, we also have All Wales Medicine Strategy Group endorsing some medicines optimisation resources. So what do we mean by medicines optimisation? Broadly speaking, medicines optimisation is about ensuring that the right patients get the right choice of medicine at the right time. So it's very much taking a look at each individual patient in a holistic way, seeing what medications they might already be on and what comorbidities they have, and evaluating what is the best choice for them. So it's very much, if we're delivering medicines optimisation, we should be supporting the patients to improve their outcomes, take their medicines correctly, should be avoiding taking any unnecessary medicines, ultimately trying to reduce any wastage of medicines, and always trying to improve the safe use of medicines. So in terms of what we produce in order to support the objectives of medicines optimisation, the categories of what we develop are on screen now. So this is how actually we organise them on our website. The biggest area probably that we work on regularly is the prescribing guidance area. So this often looks at specific areas, clinical areas or areas of prescribing a particular therapeutic group of medicines, and provides evidence-based recommendations on how best to treat patients in that area, what questions to be asking, and what options for prescribing are available. So it could be looking at specific areas such as asthma or diabetes. And very often the development of those resources will be supported, where possible, by patient information resources that the clinician can then pass on to the patient. This will include patient information leaflets. Another big area of work that we do every year is the development of the national prescribing indicators. So these are nationally agreed indicators and basically are therapeutic priorities for health boards to look at in terms of, usually with an aspect of safety or efficiency, so making the best use of the resources that NHS Wales has available. So then we further support the implementation of those indicators in health boards by producing reports on a quarterly basis on how health boards are performing against those indicators. So every quarter, a health board can see how their performance is performing over time, but also against other health boards. So for example, they can see, is that prescribing of opioids reducing in line with the targets that have been set up in the indicators. So we support the development of those quarterly reports. So if we look at some examples of what we've produced over the last 12 months in the area of medicines optimization, please do look at our website. There's a whole medicines optimization area that's relatively easy to find, I hope, that summarizes all our publications in all those different areas. And on the screen are some examples of what we've produced in just the last 12 months. But if we look at two of those examples more specifically, for example, there's the asthma management guidelines that got published last August. This is looking at adult asthma and what options are available to prescribers, depending on the patient's severity of asthma, what inhalers are available in NHS Wales to prescribe for those patients. And importantly, coming back to the poster that you saw earlier, will be undergoing a review very soon and trying to incorporate some additional advice and recommendations to try and consider prescribing of more eco-friendly inhalers whenever possible. And a little bit differently, unlike in comparison to the asthma guideline, we also produced the standards for medication review. So rather than looking at a very specific clinical area, this provides best practice recommendations on how healthcare professionals and prescribers should be carrying out medication reviews in partnership with their patients. So it sets out a lot of standards of what best practice looks like in this area and how working in partnership with patients gives them pointers on how to prepare for a medication review, gives materials that they can share with patients on how the patient can prepare for the medication review, and ultimately just sets out what questions should be being asked. And beyond just publication of this document at the start of the year, we're also supporting the implementation of the document. So we're actually carrying out pilots with various GP practices throughout Wales to see how easy it is to implement these standards in practice, and off the back of that, hopefully improve how easy it is to deliver this important area of work. So beyond just the prescribing guidance, etc., that we publish on a yearly basis, in the last year, in April of this year, we published what we're calling the Medicines Optimization Framework. So we became aware that it's not necessarily always as clear as it maybe should be about how we do what we do, the processes behind the work, and how projects are decided upon. So this document was developed and covers what medicines optimization means, and the types of resources we produce, importantly, how new projects can be proposed and by whom. I'll say now that new projects can be proposed by anybody. We accept them from healthcare professionals and professional bodies, but also the pharmaceutical industry, and most importantly, yourselves as patients or patient representatives and members of the public. I'll be touching on how you can do that in a little bit. The framework document outlines the entire process that a resource goes through, from project proposal all the way through to endorsement and eventual publication. It touches on how we carry out consultations and how to get involved with those. Again, I'll be touching on that briefly in a bit. And it also sets out how we then review publications after their publication. And finally, the optimization framework touches on planned work that we have currently, or future work that we're looking into, and how we can maybe improve our processes. So things we're already aware of. So I encourage you to go to the AWMSG website, and if you just search for the word framework, it should come up straight away, and take a look at the document and let us know any feedback you may have on it at any point. So in terms of how you can get involved in our processes, firstly, new project proposals. You can submit any ideas you think we should consider in terms of new work we should try and develop for eventual AWMSG endorsement and use on an all Wales basis. It's accessible. There is a link within the framework itself, but also on this page on the website. If you navigate through on the page where the Medicines Optimization Framework is hosted, there is a link on that page to the proposal form, and it sets out various questions, the information you can provide for us to hopefully come to the right decision about whether it's a project we take forward. And we'll always respond to any project proposal we receive. Next, obviously, every resource we produce goes through a consultation period. Again, on our website, if you navigate in the top menus, you'll have the option to access medicines optimization. And on that page, there is then a consultations area. If you go to that part of our website, whatever consultations are ever active at any given time, they'll be on that page with all the any required documentation you need to be able to send in your feedback. But of course, in further efforts to be as open as possible about what we do, it's also important that you know what's on the horizon and what we're currently working on at any given time. So likewise, on that website, there's now a work in progress section. If you go there, you'll be met with a table of all the work that we do. It sets out anticipated dates of when consultations are likely to land. But in addition, hopefully, a guide as to when the documents eventually plan to be published. And if you go there at the moment, you'll see there's actually a number of documents that are very close to consultation in the next month or so, which include the following. So we've got the All Wales Guidelines and Resources for the Management of Chronic Pain, obviously a massive, very important area for us to look into, and it is a big resource. But obviously we'd welcome any feedback that any patient group representatives or patients themselves have on any aspect of that document when it's available. Likewise, as I've already mentioned, there'll be the Adult Asthma Management and Prescribing Guidelines. They're being updated to incorporate some of those eco-friendly inhaler advice. And likewise, that's happening for the COPD Management and Prescribing Guidelines. And lastly, as I already mentioned, national prescribing indicators. We do change them on an annual basis. And we're coming up to the time now to go through the consultation phase for those indicators that will be in place from April 2022 through March 2023. So please, any aspect of any of these documents, they can sometimes be very technical, but if you only want to comment on one part, or you have a particular interest in one area, just send in any comments you may have. We'll consider them all, and we do make every effort to address any comments we receive. So if I was to ask you to go away with anything from this talk, I just ask you, please explore our resources, look at anything that takes your interest, and at any point provide your feedback on those. Outside of consultations after it's published, please get in touch with us if you have anything you want to let us know. Please read our medicines optimization framework, give any feedback on the document itself, but also if you have any ideas for how we might be able to improve our processes in general, let us know. And then finally, always please feel free to submit any project ideas you think we should consider, and please get involved in any of our consultations you wish to. So I'll end with just a quick thank you and a diolch, and I'll hand back to Claire. But yeah, thank you for your time, for listening to me, and hope that was informative.
Oh, thank you very much, Tom. Yes, it was very informative, so thank you. And well, that wraps up all our presentations for today. However, we do have a few minutes available for any questions or comments about what you've heard today, or just questions in general about AWTTC and AWMSG. So if anybody wants to ask anything at all, please go ahead.
Can I just ask Tom a question?
Hello. Absolutely.
Downward pressure on prescribing for, and we've had prudent healthcare from a previous health minister, and perhaps we've got now value-based healthcare. What sort of influence does that have on your sort of the things you look at through your prescribing indicators, and perhaps your medicines optimization framework? Does it have this downward influence on prescribing?
So when it comes to things like value-based healthcare, I would definitely say that's an area we're constantly trying to incorporate into our resources and consider, what the clinical outcome might be, rather than just looking at what should be prescribed. I think when it comes to the indicators, sometimes we're a little bit limited by the data that currently we have access to in terms of trying to make value-based indicators, but we're working with all the what was NWIS, so the information service, who provide all the data and software and things behind where we get our data from. We're working with them to try and be able to feed value-based healthcare into everything we do, such as the indicators and the medicines optimization resources that we produce. So making data and all those value-based outcomes a more integral part of what we're delivering. But I'd say that. I don't know if Richard, you want to add anything on that?
No, that's an excellent answer, Tom. I was only going to say that access to data is a very topical issue at the moment, particularly in NHS England, where they've been obviously mandating a release of data, and that's been delayed because of significant concerns from not only healthcare professionals, but obviously patients and the public as well. And it's really important, I think, from our point of view, that there is that safe use of data, but also that there's an extended availability of the data, because as Thomas described, is that the data that we have really hasn't changed for a very long time. And until we have more specific data and data that we can drive down further on, then we can't really bring in the further aspects that are needed. There's obviously work going on within Wales, within the value-based healthcare programme, where they're combining data from a number of different sources to enable a better picture, really, of what's going on. And within, particularly within the Welsh Analytical Prescriber Support Unit, but obviously within AWTTC as a wider objective, we are contributing to the development of a national data repository, which is actually going to allow all data to be located in one place. And then this then enables that process to be something that's more sophisticated, and hopefully will allow us to have data that can tell, as I say, that bigger picture, and allow us to see where there is what happens. So one of the programs that has been running for a couple of years is the Low Value for Prescribing program, which at the moment can only look at the prescribing of specific items. It doesn't actually look at what maybe patients are then changed to. And then that you know, as that develops, that could give us a much better picture of actually what the prescribing is and how that has changed as a result of the program, or maybe not has changed. So
I think that's, thank you, especially, you know, that's a big topic on the data, and we've got a lot of big data. And from the patient point of view, I can understand people's concerns, you know, and, you know, where is my data being used? And have I given permission for my data to be used? And that's an ongoing conversation that we need to have in going forward. And we do need to involve, we need to look from the patient point of view, and you can, from your own point of view as well. And I've got just one comment about prescribing indicators as well. And one of my comments really is, when we say, look, we're not going to use this, and the value of not using, say we saved 500,000 this year because we've switched from this medication and not used this medication. We don't have to look at the wider picture. So I'm taking up Richard's point of view. What is that patient being switched to? What's the cost of that? You know, and so sometimes the value of prescribing indicators is not always there. You know, the true costs. That's what I'm saying. Yeah.
No, I mean, in terms of the national prescribing indicators, there is obviously an element of efficiency within them, and there are 3 specific efficiency indicators. But in general, they tend to be, you know, selected because there is more of a patient safety concern around them.
Yes, I've seen those indicators. Yes.
Whereas the more of the low value for prescribing initiative tends to be more focused on what you've described as those actual costs. But you know, I completely agree that there needs to be a much more collaborative discussion really around the availability of data, because you know, outside of this role, you know, as a patient, then I don't want my data to be shared without me fully knowing where it's going to and for what purpose.
And who's going to sell it on? That's the that's the big concern sometimes. Yeah.
So I think, yes, I mean, maybe this is an opportunity to use this forum as for some of that discussion. You know, that
I would welcome that discussion. Yeah, I would welcome.
I think that would be an item for an agenda item for a future meeting. Definitely.
Can I just come in here, please?
Yes.
SAIL, I work with SAIL, and as you know, we have in Wales, we're very fortunate, we're quite small, and so therefore SAIL covers everything in Wales. Let me reassure you, Richard, that I really gave them a hard time and I've been with them for about 12 and a half years, probably since they started, on anonymising patient data. And I was assured by all the professors, Ronan, one of the big professors there, and Carida, that there is no way that they can get at our data. And I've really worked on that. And where there is information for patients, we've worked on that too. We've had posters put up in GP surgeries saying that your data is going in, not all, GP surgeries aren't made to put the patient data through if they don't want to. It's not compulsory. But unless we get this data, we're not going to move forward. We need data. It's the thing of the future. And if we want to change things, that data, and it's here for you if you want to access it, Richard. And, you know, we need this. And I'm assuring you that the anomaly is there. We're not England. We're not selling stuff off. We're not doing that. That was a huge thing a few years ago, as we know. England has a different, it's more fragmented in England anyway because of the size of it. So, right, I could go on forever about this. I'm not, because we're coming to the end of the meeting. But there's lots of reassurances there, Richard, and you are okay. But we could do this as a debate later. I'm sure that's fine. I was we talked about chronic pain, Tom. How are you collaborating? Because there's been a huge, there's just been a huge amount of grant money given to the study on pain. There's a huge amount of people involved with it. Lots of professors, lots of and so it's out there if you wanted to look at that. And we should all be collaborating. We're not going to be inventing the wheel all the time, but it's out there. It's going to be a big study. It's a lot of money, and hopefully maybe, you could look at that. I think it's only sort of just started. The other thing I was concerned about, Tom, I will shut up in a minute. The other thing I was concerned about was multimorbidity, comorbidities, multimorbidities from that, which is a big thing now, multimorbidities is a big research. I do a lot with research, as you can tell. There's a lot of research on that. So you've got that combination of all these drugs. In fact, recently my diabetic specialist said, put me on a new drug. And I pointed out to her, you know what I'm on already? And she said, oh, stop that one, because it doesn't comply. And I'm thinking, thank God that I mentioned it. So, for me, that's why I'm still with PAPIG, is I'm really interested because I take a lot of medication and I'd really rather not. So if you want a guinea pig to say that's not doing you any good or that, because I have frank Medicare at the moment, because some of my medication comes from in the post, therefore it doesn't go through the pharmacy. So they're not going to pick up on it, because maybe they don't know about it. So yeah, is it right? Right, Tom, so if you want.
Yeah.
Oh, thank you very much.
Sorry for going on.
No, that's what we want. We want people to, participate in everything. So thank you.
Claire,
I'm just going to...
Some comments in the chat that we just need to pick
I was
up
just
on.
going to pick up on.
And I think this subject might be a really good one to discuss, and for a future meeting, Claire.
I think so, definitely. Yes, looking at data, and I think the part, as Claire has mentioned in the chat, it is a partnership, isn't it? We can't expect as patients the NHS to deliver the services we want if they can't access, or we can't access, the data that will facilitate that happening. So, that there's got to be a partnership between people, patients being willing to share data, but obviously in a way that it is anonymised. And
we could get somebody from Sale to come and talk to us.
I'm sure we could, or certainly from our colleagues, in what was MWIS, is now DHCW. Yes, so we will look at that for a future meeting. So that's great. Hello, Claire.
Hi. Yeah, sorry. Just to pick up on the comments that I put in the chat. I've seen a lot of discussions going on in a lot of other organisations in groups similar to this. And excuse me, mention of Digital Healthcare Wales and the work that they are doing, bringing together, the various different platforms and so on and so forth. And I think it also links back to other things in terms of the comment that was previously made about patients saying, not about us, without us. So, NHS organisations and the various different clusters are involving patient groups like this in discussions about consent and sharing data and using data. And from the information that I've seen, I'm quite, I'm very strong on the fact that you don't have a discussion about me without me. Okay, so I'm firmly in that camp, and even it being in that camp, I'm comfortable that the way that patient data is being handled and the discussions that are going on about consent for using patient data are being properly handled. Data is being properly secured, data is being properly anonymised, and we have to get to grips with the fact in Wales that unless we use that anonymised, secure data in the best ways that we can within the NHS in Wales for research, for clinical improvement, we won't tackle the inequalities that exist within Wales. We have to have proper access to that data, and I'm quite confident and comfortable that the people that are using the data are using it properly and using it safely.
Yeah. No, I totally agree with that, Claire. And yes, and I think, yes, this is a topic that we should explore more perhaps at our next meeting. So we'll work on that and get some of our colleagues from DHCW to come and talk to the group as well. But I'm afraid time has now beaten us, and it's time to draw this event to a close. And we'd just like to thank you all for joining us today and for taking part. And, you know, we just want to re-emphasize, you know, we really do want you on board with us, because, you know, your input and your views into our work is essential for what we do. As I've stated, we will be sending out an email to everyone who's attended this morning, and we will include any answers to any questions we haven't got round to answering, and we'll also include details about those opportunities that have been mentioned, where you know where you can participate. Certainly Lynette's research project and Claire's, and you know the optimization framework and all those things. So details will be in that email. In addition, there is also going to be a small, I'm afraid, online feedback form about what you thought of today's meeting. So if you could fill that in, we would very much appreciate it. And also, please feel free to email us at any time, you know, if you want to raise anything with us. You know, we always welcome engagement. So please, you know, please go ahead and do that. Anyway, I'm going to shut up now, and I just want to say I hope you found this morning's meeting informative and useful, and we really hope to see you at our next PAPIG meeting, which will be in October. So we will keep you posted and let you know when that will be. So until then, wishing you all a safe, happy and healthy summer, and see you in the autumn, hopefully. Take care. Bye-bye.